Okay, so good day. Today we will going to discuss on how to perform the Leopold's maneuver. Okay, so good morning, ma'am. I am your nurse for today. So how are you? Okay, so let us identify first the patient using two identifiers. So, ma'am, you are Miss Martinez. Okay, so your birthday is? Okay, December 8, 1994. So after identifying the patient, let us ensure the patient's privacy by closing the curtains. Okay, and then after that is perform hand hygiene. And of course, ma'am, would you like to go to the bathroom? No. Okay, so let us ask the patient if she wants to go to the bathroom in order for the patient to have an empty bladder before starting the procedure. Okay, so after performing hand hygiene, ensuring the patient's privacy, let us now explain the procedure to the patient. So, ma'am, we're going to do Leopold's maneuver. So, Leopold's maneuver is a four-step procedure in order for us to identify first the fetal position, and then the second one is the fetal presentation. So now, we're going now to expose the body parts of the patient that we're going to assess. So make sure that you will only expose the area or the abdomen that you're going to palpate, okay, to ensure patient's privacy. So we have four procedures in the Leopold's maneuver. We have the fundal grip, the second one is the umbilical grip, and then the third one is the pollex grip, and then the fourth one is the pelvic grip. Okay, so first maneuver is the fundal grip. So now, let us put or place our warm hands, particularly the palms of our hands, on the superior surface of the fundus. Okay, so make sure, class, that you're going to warm first your hands before placing it on the patient's abdomen to prevent abdominal muscle contraction. So after warming our hands, let us place our palms on the superior surface of the fundus, and then we're going to, using our fingers, we're going to palpate for the fundal region of the abdomen. Okay? So, here, in the fundal grip, we are identifying the presentation, fetal presentation. So, if ang napalpate po natin is round and hard, and it is independently moving while we are pressing our fingers on the fundus, the fetal presentation is the head. Okay? Pero kung ang napalpate po natin is soft, and then, soft and less defined, yung napalpate po natin na fetal part, that is the bridge. Okay? Bridge position po. So, after po ng fundal grip, the second one is the umbilical grip. Okay? So, in the umbilical grip, facing again the head of the patient, we are going to place our palms on either both sides of the abdomen. Okay? So, this time, gagamit po tayo ng bimanual palpation. So, now, sa bimanual palpation, one hand is used to support the abdomen, and then the other hand is used to palpate. Okay? So, dito po sa umbilical grip, dinedetermine po natin ang location ng fetal back ng patient. So, how do we do umbilical grip palpation? So, let us put our palms on both sides of the abdomen, and either both sides of the abdomen, and then, steady lang po yung isang kamay for support, and then the other one is used to palpate. So, mag-start po tayo top to bottom. And then, repeat on the other side. Okay, support po. And then, yung other hand naman ang magpapalpate again from top to bottom. So, paano po natin malalaman nasa ng fetal back? Okay? So, pag ang na-feel po ng ating hands is flat, hard, and barely movable, that is the fetal back. Pero kung ang na-feel po natin or napalpate natin is para siyang mga merong nodular angles, so that implies that those are the elbows and knees of the fetus. Okay? Okay? So that is the second maneuver, the umbilical grip. So the third maneuver is the pollex grip. So sa pollex grip naman, dito po tayo sa lower abdomen. Okay? So sa lower abdomen, using our thumb and fingers, we will place our palms, okay, our hands here at the lower abdomen, just above the symphysis pubis. And then we will try gently press, okay, yung ating thumb and fingers. Okay, and then we will identify if there are any movements or if yung napapalpate natin dito na presenting part is hard or soft. Okay? Pag pinalpate po natin or try natin i-press together yung ating thumbs and ating fingers at naka-feel po tayo ng hard, okay, presenting part, ibig sabihin this is cephalic presentation or head. Okay? Kapag soft po yung na-feel natin or napalpate natin, that is breech presentation. And then another is i-identify natin kung may movement. So pag press po natin lightly yung thumb and fingers, and then the presenting part moves upward, ibig sabihin po, the presenting part is not engaged. Pero kapag press po natin lightly together at hindi na po siya nag-move, ibig sabihin engaged na po yung presenting part ng fetus. So that is the pollex grip. And then the last but not the least is the pelvic grip. So this time, we will now face towards the foot of the patient. So ilalagay lang po natin yung ating palms, okay, 2 inches above the inguinal ligaments. Okay? 2 inches above the inguinal ligaments, and then after that, what you're going to do, the fingers will push downward and inward. Downward and inward. Okay? So itong pelvic grip po na ito, ang ina-assess po nito is yung fetal attitude at saka yung degree of extension of the fetus to the pelvis. Okay? So usually po, ang pelvic grip ay ginagawa lang natin kapag po cephalic presentation. Okay? And then, yun po, ang ating 4 maneuvers sa ating Leopolds. So after po natin itong ma-perform lahat, we will now cover the exposed body parts of the patient, ensure that the patient is comfortable. Okay, and by the way pala, no, the position of the patient when you are doing Leopold's maneuver is dorsal recumbent position para po ma-ensure natin na relax po yung abdominal muscles ng patient natin while we are palpating. Kasi kung naka-supine position po ang patient natin, ang tendency po pwedeng mag-contract yung abdominal muscles. So pag nagpapalpate po tayo, lalo na kapag bimanual and deep palpation, is pwede pong mag-result yun sa inaccurate findings. So kapag po comfortable na po ang patient natin, okay, we will perform hand hygiene and then document the findings and evaluate the results, and that's it. So ulitin ko lang po, 4 maneuvers po tayo. First is the fundal grip, second is the umbilical grip, the third is the pollex grip, and then the fourth is the pelvic grip. Okay, that's all. Thank you.